Hi friends, once again welcome back to my YouTube channel Future Midwife. After a couple of week delay, again I am here in front of you to take the classes. First of all, I apologize for the delay of classes. Actually, I was sick. I couldn't have a good voice to take the classes for you. Still I am sick, but keep on delaying the video is not good, I feel. Few of my viewers, they send me a message. They ask me, madam, what you happen actually, what is a delay for the next video? So I send personal message to them. Still I am so happy. Few of them are eagerly waiting for my videos. That is a good thing. Anyway, do you have any idea where we reached our classes? So we have completed the antenatal and intranatal conditions. Next we will move on to the postnatal conditions. So today I'll be discussing about the puerperium and what all are the main changes going to happen during puerperium. Actually, what do you mean by puerperium? Puerperium is otherwise called a postnatal period. So we'll see what you mean by puerperium. Puerperium is the period after the delivery till 6 weeks. During this stage, anatomically and physiologically, all the reproductive organ, including the body tissue, will be revert back to the non-pregnant stage. Usually it starts soon after the delivery of the placenta, exactly 6 weeks. That means around 42 days. All the pelvic organ, as I said you, including the body tissue, will be revert back to the pre-pregnant stage. This puerperal stage can be divided into 3 stages. The first one is immediate stage, that means within 24 hours. The next one is early stage, which include 7 days, that means within 7 days of puerperium is called early stage. Next one is remote stage, which can be extended up to 6 weeks. The main physiological changes during puerperium is involution of the uterus. So when it comes to the anatomical consideration, at the time of delivery, the uterus measures 20 into 12 into 7.5 centimeter, approximately 1000 gram. So at the time of 6 weeks, it automatically reaches to the 60 gram, that is in the pre-pregnant size. So usually it happens during the involution time, or once it reaches completely the involution, it reaches the size of 60 gram. So other remaining pelvic organs like isthmus will be coming back to the normal state within few days. Next one is the contour of the uterus. The contour of the uterus will be come to the normal stage within 6 weeks. External os never revert back to the normal stage. Fundus lies 13.5 centimeter above the symphysis pubis for the first 24 hours of the delivery. After that, the steady decrease by 0.5 inches for the next 24 hours. On the day of 14, the uterus cannot be palpable. That means it almost reached to the pelvic organ. So we cannot palpate the uterus. Once the 6 weeks complete, all the reproductive organs, including the body tissue, will be revert back to the normal stage. So we can say the woman's condition revert back to the pre-pregnant stage. Next, I would like to discuss about the lochia. Lochia is the bloody vaginal discharge following the childbirth. According to the color and composition, we can categorize the lochia into 3. Lochia rubra, lochia serosa and lochia alba. So we will see one by one. Lochia rubra is a red in color, which will be extend 1 to 4 days, which include blood, fetal membrane, decidual shreds, lanugo and meconium. Next will be the lochia serosa, which is pink in color, so which will be extended 5 to 6 days, which include leukocytes, cervical mucus, wound exudate and microorganism. The last one is lochia alba, which is yellowish to whitish in color. which will be continue 10 to 15 days, which include decidual cells, leukocytes, mucus, colostrum crystals, fatty epithelial cells and microorganisms. Lochia has some clinical importance. If the lochia has a malodors which indicate there is a puerperal sepsis, presence of E. coli that is. So if it is scanty or absent, which indicate there is infection or lochiometra. If there is excessive lochia, which always indicate the infection. If the red color persists for long days, which indicate the subinvolution. Subinvolution means the involution is not taking place properly according to the normal criteria. If the red color persists, again it indicates is there any retained conceptus. Next, there is any cause of secondary PPH. These all conditions can be suspected if the red color persists for a long time. If the lochia alba will be present beyond the 3 weeks, which indicate local genital infections. Changes in the breast and lactation will be the next important physiological changes. Here during the lactation period, there are 4 physiological changes will be happen. These are mammogenesis, lactogenesis, galactopoiesis and galactokinesis. So mammogenesis, obviously you know, it's a development of the mammary gland. Usually it starts from the conception onwards. So here the lactogenesis is the initiation of the milk secretion from the alveoli. So next one is galactopoiesis. Galactopoiesis means the maintenance of the lactation. The last one is galactokinesis. That means the ejection of milk from the breast. So here the ejection of milk from the breast will be happen with the help of a hormone called oxytocin as well as the baby suck. The prolactin is the important hormone which will be secreting during the lactation period. The hormone prolactin have an influence throughout the lactation period. This prolactin will be helping for the maintenance of lactation throughout the feeding period. Apart from that, there are few general physiological changes also happen during puerperal period. So we will see one by one. The first changes will be in the pulse. Raises but settle down to normal on second day. Next one will be the temperature. Any rise above 0.5 degrees Celsius suggestive of infection of genital urinary tract. There are some changes in the urinary tract which pronounced diuresis on the second and third day. Over distension, incomplete emptying, presence of residual urine, high risk of infections. In the gastrointestinal system, there is increased thirst and chances of constipation. When it comes to the weight loss, 5 to 6 kg reduction will be occurs due to the expulsion of fetus, placenta, liquor and blood. Around 2 kg during puerperium there is a loss due to diuresis. It will be continue up to 6 months of the delivery. So in short, by the 6th week you should be able to lose half of the weight of you ordered during pregnancy, but only if you gain the recommended 25 to 35 pounds. Next will be the blood value changes. Immediately there is a reduction in the blood volume which will be normalized within 2 weeks. Rise in cardiac output which will be normalized within 1 week. Leukocytosis due to stress. There is a presence of hypercoagulable state for 48 hours. Fibrinolytic activity enhanced in 4 days. In case of menstruation, if not breastfeeding, it will be resumed in 6 to 8 weeks. When it comes to the ovulation, in case of non-lactating mother, the ovulation will be taking place after 4 weeks. If it is lactating mother, it can be extend up to 10 weeks. Exclusive breastfeeding around 98%, which gives a contraception up to 6 months. So next I will discuss about the abnormal puerperium. There are a few complications I will explain now. So whenever there is a puerperal sepsis, which can be indicated with the help of signs and symptoms, pelvic pain, fever, subinvolution, there is presence of foul swelling, vaginal discharge. So these are the typical signs of puerperal sepsis. Another puerperal complication is puerperal pyrexia. So next, in each system there is few complications will be happen. So we'll see one by one. When it comes to the breast, there are few breast problems which called retracted or cracked nipples, breast engorgement, mastitis, breast abscess, failure of lactations. So these are the complications of breast during puerperium. When it comes to the urinary tract, there are few urinary problems also, that is retention, incontinence and infections. Apart from that, there is venous thrombosis, secondary hemorrhage, puerperal psychosis and obstetrical palsy. So these are few complications which can be happen during puerperium. So here we can wind up our today's section. So in this video I just explained the normal physiological changes which happen during puerperium, and also in the last I just list down the puerperal complications. I know the explanation of puerperal complication is not enough for the nursing students. So next class I will continue with the puerperal complications and its management. So till that, take care, bye bye.